Look at this PYQ of embryology. That is previous year question. Fertilization, they have asked for 5 marks. So fertilization is a very, very broad topic. You will have to explain it for 5 marks. So let's get started. So first of all, define fertilization. The female gamete and the male gamete coming together to form a zygote is fertilization. So basically, how does this happen? By an act of coitus or sexual intercourse. The male deposits the sperms into the vagina of the female. You can draw this diagram: uterus, cervix, vagina. Here you have the fallopian tube, the fimbriae, the ovary, and showing the sperm's path where it will meet the secondary oocyte in the ampulla of the fallopian tube. So the sperm will penetrate the corona radiata, then the zona pellucida, and then the vitelline membrane to reach the secondary oocyte's nuclear material, right? And then what will happen? The secondary oocyte will complete its second meiotic division, which was arrested till now. So second meiotic division of the secondary oocyte, which was arrested till now, will get completed. And what else will happen? There is a zygote that is formed. What are the results of fertilization? They'll ask you in the exam. So the results of fertilization are these only: that the zygote is formed. The secondary oocyte is going to undergo, first thing you have to write is the secondary oocyte will undergo will complete its second meiotic division, then only the zygote is formed. So once zygote is formed, what will happen? The diploid number of chromosomes are restored. Then you have the sex determination of the zygote. Then you have a variation in species because of all this genetic material from father and mother. There's variation of species, and then there's going to be cleavage. Initiation of cleavage means what? The zygote, which is a single cell, will become 2-cell stage. Then you have a 3-cell stage. Then you have a 4-cell stage. Then you say there is a 16-cell stage, which is called as a morula, and so on and so forth. And then it will go and implant in the uterus. Remember, what will implant? The blastocyst will implant. What else you should know about fertilization that they can ask you? See, the sperm is going to be viable around 5 days inside the female reproductive tract. The oocyte, however, which has been released on the 14th day of the menstrual cycle, this can stay only up to 2 days. Okay. So between this, if there is a possibility, then only they fertilized, and then only it will go to get implanted. Okay. So this much of story is enough. One clinical you write now, clinical embryology, you just say that nowadays what fertilization people are doing, in vitro fertilization. So many things have come, right? In the lab, the fertilization happens. So that is something like test tube baby.